I'm the pharmacy manager here at the Centura Health Pharmacy at Porter Adventist Hospital. I have been precepting for 7 years. We precept over 20 students a year at just my pharmacy. You know, the first day is a lot of just getting to know each other. I like to get to know the students, for their background, what they're looking for with their rotation, and kind of find out areas of improvement. I actually have them fill out a questionnaire as to what they want to get out of the rotation. It is fun. I really enjoy the experiences that I have with the students on rotation. I feel like it's an opportunity to learn from the students. They're very up to date with all the new trends and studies. I like being able to shape their future career. And I like just having that interaction and being able to guide them along their journey. So I run the outpatient clinic pharmacy here at Porter Hospital. And when I started, we primarily just filled prescriptions. Since we've taken on students, we've started new services as well as expanded our current services. So the new services that we started are the immunization and travel health clinic. So when I came out of school, I didn't know how to vaccinate. My first student actually showed me how to vaccinate. Then from there, I started the travel clinic, and now we do mass flu clinics. We have patients paying us to sit down with us, like an MTM visit. We go over the vaccines and medications that they might need, and then we generate revenue based on the vaccines that we give. We also expanded clinical services for our discharge prescriptions. So when patients leave the hospital, we're able to deliver to the floor, educate the patients, ask them if they have any questions. So this is our role in the outpatient setting at the hospital to prevent readmissions. And having students on rotation, that's how I've been able to grow these services. I think introducing students earlier on in the program is a great idea. The reason is I feel like sometimes students just they don't know how to apply what they learn, and they don't have that confidence when they get out on rotation or in the real world. I think the students are used to being in a classroom where things are just kind of thrown at them and everything's nicely packaged together. But in real life, you may not have all the details that you need to answer a question. Sometimes it takes more critical thinking on the students' part. So in school, they're just kind of, accepting all the information that's coming at them, but they don't know how to apply that to real life. So when they come on rotation, they actually have to use that clinical knowledge and apply it to the scenario. So I think that's the main difference, is applying what you know in a real life setting.
I think it's a great idea to add on to the curriculum. It's a completely different experience than being on like your IPI rotations. I think the students will definitely be better prepared coming into the rest of their IPI rotations. And also I think it's going to help them a lot with the capstone course. Just having like a full 6-week rotation in whatever pharmacy setting, it'll kind of help tie things together.
The advantages of getting exposed sooner to work environment in the pharmacy is that you have no fear to counsel patients, really get the hands-on experience rather than reading your pharmacy notes.
I think the experiences now are much different, and just being immersed in the rotation, 10, 12 hours a day, like 5 days a week, is much different than 2 or 3 hours every couple weeks here and there. So it's much different that you can follow patients, you can follow the workflow, and you really have a better understanding of what's going on behind the scenes, as opposed to when you're there for a couple hours, you know what's going on at that period of time.
One of the advantages of having students on rotation is that they are very up to date with the latest guidelines, the latest readings. So if a clinical scenario comes up, I can ask them to use their resources from the school to look up something, or they'll tell me something that's new that I don't know. And I've been out for 14 years, so things have changed. So a lot of times I'm like, whoa, what have you learned in school about this? And they'll say, well, we don't learn that anymore. And I'm shocked by it, because that was like a mainstay of when I was a student. So I think it's very beneficial to have that current knowledge be at our rotation site, because I learned just as much from the students as they do from our site. Rotations are a good opportunity for students to not just network, but have an on-the-job interview. So, for example, we've actually hired 2 students that have come through rotations with us. I would highly recommend being a preceptor, and it's a way to stay connected to the pharmacy community, to give back to the community. It is a lot of work, but it's also very rewarding. You get as much back as you give. So, the students are just so enthusiastic. They're very thankful, and they're eager to learn, and it's just nice to be around that energy, that positive energy. I've had a really great relationship with the School of Pharmacy. I feel like the school supports the preceptors, and I would encourage pharmacists out there, be a preceptor, connect back to the school, connect back to the community. It's been great. I've had nothing but good experiences with being a preceptor, so I highly recommend it.